Hello, good evening, good morning, good afternoon, everyone. Welcome back to the continuation of the ZINC and ECBS conferences. I would just like to shortly announce the next panel, which is just about to start. The topic on overcoming healthcare challenges by means of technology. Can we prevent the future pandemics? I will now give floor to the moderator of this panel, Professor Saraju Mohanty.
Hello, everybody. This is panel 6. I welcome you all the attendees, all the panelists. So we have a very interesting panel on overcoming healthcare challenges by means of technology. And technology here is essentially consumer technology and other things. And can we prevent future pandemics? That's the topic. And we have 5 panelists here. I'm Saraju Mohanty from Texas, US. Kousik Sankar from Svasthiya Technology from India, Reinhard Moeller from University of Wuppertal, Germany, Himanshu Thapliyal from Kentucky, US, Madhavi from Pittsburgh, US. So what we'll do, we'll follow kind of 3 different parts here. First, a few minutes we'll give time to each panelist to present their views. And then I'll have several questions to all the panelists, and they can basically volunteer to address whatever the questions on the floor. And then third part, we'll open the floor to all the attendees for further discussion. So I go with some slides here, which are essentially in this pandemic we are worried about, which is comorbidities and diabetes, stress, cardiovascular. All these are considered as serious problems in this pandemic. And stress is very important. Everybody is aware of, and whether it's a day-to-day life or in this pandemic where most of us are locked in our house, having very minimal outdoor activities. So how we can monitor stress and then manage stress, that's important that various consumer technology can do. For us, starting from physiological monitoring to sleep habit monitoring to diet, all these are all the possibilities are there, and consumer technology has been playing a role in the form of various software and hardware, and will continue to playing a role. And some technologies with AI capabilities, machine learning capabilities, can provide short-term and long-term advice on stress management. So somebody is stressed out, so how to have some short-term and long-term remedies that technology can provide. And technology like this, virtual realities and so on, can play definitely significant role in managing the stress and depression aspects. Food is very important. Food is our basically everything that body takes and then accumulates, and then as per that we function. And bad food essentially can have various direct and indirect issues with respect to how we have quality of life and stress and so on. So then in addition to what we are eating, automatically keeping track of those, how we can predict that is what is our next diet, so that we have a balanced basically meal. So that's important that the consumer technologies can provide. One interesting thing that during this pandemic we are all witnessing, that is diabetes patients or people with imbalanced glucose and so on having serious health issues. And definitely consumer technology, which this is a futuristic, that is non-invasive glucose level monitoring. A lot of companies are trying, okay, from they know from US, from India, then from Germany, Israel, and UK. I see various companies are trying to come up with non-invasive glucose level monitoring. And along with that, if we can have a diet monitoring aspect integrated, so then we can have an excellent solution where food intake is automatically monitored, glucose level is automatically monitored, and to serious people, insulin can be automatically injected. So that's the big idea that I think consumer technology can provide, where diet, glucose level automatically monitored, and if needed, insulin injected in automatic fashion. And for the people with heart issues, we can have different wearables. that means obviously for serious people, where a dress which has electronics, so that is a e-textile kind of mechanism, and that is automatically monitoring the heart condition and sending basically alarms or warnings whenever situation arises. Then in the pandemic, automatic social distancing, or at least a warning that if you go closer to another individual, you may potentially get basically the virus because of its airborne and other situations. So this a lot of apps are coming like that with maybe GPS enabled or Bluetooth enabled, so that this can be done in a much automatic fashion. And in the back end of this kind of system, where we want to have basically social distancing capabilities, and then we're traveling across the border, that means international travel and so on, how we can have certain information sharing, so that people know that when a person X is going to a different country, what is the health history and so on. So which is not violating the privacy aspect, at the same time providing enough information so that people can make assessment of various health hazard and so on that's possible as a result of travel. And in this context, in the Consumer Electronics magazine, we have the previous one, Easy Band, one paper presented, published, one article published in Consumer Electronics magazine. Another article is now in early access, blockchain, where these aspects, that is healthcare data, is being shared among the government entities while assuring the personal privacy aspects. This is possible if we have a global network with a certain paradigm like blockchain, so that we have privacy as preserved along with the healthcare sharing. And smart healthcare, that we call, has essentially many roles to play, as you can now see it, like teleconsulting and so on, glucose monitoring, and other things that we just discussed. In addition to that, I think like trusted food supply chain, okay, in the pandemic, along with the pharmaceutical medicines we are buying, and we are buying food, definitely whether pandemic or not. So how to have trusted food supply chain is an important aspect as well. And automation can play a major role in during the pandemic, and can help to prevent the infection and so on. So, for example, healthcare sector, robots and so on, then even tourism and hospital industries can take advantage of automation. So those are my thoughts that we just saw, and with this we'll move to the next panelist, Kousik. You have 5 minutes.
Yeah. So some of the current healthcare ecosystem challenges I have attempted to list down here. And the first is that, of course, all this is actually pre-pandemic. And during the pre-pandemic things, we had all of the healthcare data per se is actually physically, media heavy. And we have a lot of security concerns. Plus, if you analyze the entire operational workflow, there are actually a lot of inefficiencies, starting from the patient, from the medical fraternity, from the infrastructure, etc. And to add to it, there is also a lot of shortage of skilled people, and especially in case of pandemics, wherein CT, etc. is, radiology is the most, I would say, deterministic modality right now. You have acute shortage of skilled radiologists, and if you see the Indian numbers, you have hardly about 10 to 12,000 radiologists for a population of 1.4 billion, and I'm sure the numbers would be more or less the same, maybe slightly better in other countries. And to add to that, now and then after that, you got Corona, and that posed a lot of additional challenges, wherein we saw overload of the infrastructure, overload on the medical fraternity, and to top it all, you had lack of information with all the social media and the internet actually proliferation. There was still a lot of lack of information, and To make it even worse, you had misinformation, which is also spreading at a very fast rate, and then some. So, and this is some bit of grim history. I mean, I just wanted to sort of set the context here. So, I don't want to go into the details, but as you can see here, row number 9 is for the COVID-19 pandemic, and yeah. So the thing is, from a technology standpoint, what is it that we can do, and what are the kind of learnings that we have? That is something which we could discuss. And of course, technology is just one axis. There are actually multiple axes, and then I think a combination of all of those axes is what would help to achieve an optimal balance. Yeah. A little bit about my background. I'm the founder of SWAS, and SWAS in Sanskrit means a fresh breath of life, and it's a startup, and we had formed it in 2019. And a little bit about my background is that I've worked in the corporate world, both in Bangalore, in Netherlands, as well as in Tokyo. Yeah, that's about it. Yeah, thanks.
Thank you. And can you please close so that Reinhard can start?
Yeah, I want to give some short remarks just because the highly defined technological and historical background is already given. Still, we have got some problems that I've seen in the last 2 years with the pandemic, and that I want to stress here. I mean, what is smart? Can we make use of smart health care and consumer technology against the pandemic? And as you have said some things before, it is both possible, of course. So, but the first thing we have to think about is, do we have a working digital health system? What we learned in the last 2 years is that we don't have really a digital health system that is working totally. There are a lot of solutions where you can find something where doctors can communicate with patients communicate with healthcare systems, but there is no total system that is covering all the participants in this system. That means public health authorities, politics, and so on, and they are not uniformly connected. And this is a big issue. And another big issue is the national and international responsibilities. Especially in Germany, I noticed that we, even in local areas, we have different responsibilities in this pandemic. And that is, of course, hindering a complete and total handling of this pandemic. And I think it is similar in many other countries as well. So strategies, national strategies or also local strategies are politically influenced. That means politicians often decide on what is to do with the pandemics and how is it to handle, and how are the tools that can be used in this pandemics. And this is really not really good working. So they are independent from pandemic situation, and often they don't even hear on the advice of epidemiologists. So what are the lessons to learn from this? I mean, some countries have done better. We know that we heard some good news from Israel, for example, who a country that very early had started vaccination. They had a really good healthcare system where the patients and generally all users are connected within a public health system. So what is the next things? Well, we have too many communication constraints. One of the constraints is that oftenly, and again I must say this is for Germany, maybe other countries have the same problems, we have often to do with paperwork or fax machines that are communicating direct information from testing, from vaccination and so on. So no direct digital communication to the healthcare authorities. Then we have standards and tools that are different locally, different nationally, and also internationally, of course. We have seen some technology aspects already given from Professor Mohanty, but still this is something that is national or maybe in a broader context, but not worldwide. And we need something that is worldwide. different technologies in users' hands is also a problem. I mean, in our country, in Europe, many people use smartphones. And we in the Consumer Electronics and Consumer Technology Society normally talk about smartphones when we are talking about the newest brand of technology. But you can say that there are a lot of people that are not using this modern technology at all. And in a pandemic, we need something that is working for all of us and not only for the technology used people. Okay, so and user abilities to use electronic devices is also different. You know, we have a lot of talks in healthcare presentations when we are talking about elderly and disabled people that are not, of course, able to use the modern technology as well. And still, we have some warning apps, for example, in pandemics here, that have flaws. That means you must be close to somebody who's infected, and the distance is making matter than the time. How long are you in close to this person? And the acceptance of people, very important, the acceptance. So, third slide is, okay, I'm over time. Was it?
No, that's okay. You can go 1 minute.
Okay. The third thing is security and privacy. Users are seldomly concerned with when using their Facebook accounts, for example. So they give much of their information. But users request highest privacy and security from state or authorities on the other hand. So many users still object handling the pandemic, and also they are objecting against the vaccination. And finally, we have national legal restrictions that also hindering these kind of apps. Here's a link. You can see it in the presentation. I give it afterwards if somebody is interested. So what are the possible solutions? We can use age-independent technologies. For example, we can use electronic cards, smart health cards. So can give them many names. We can use standardized international, at least national, but compatible over the world communication and databases and applications. We also can provide, from a consumer technology point of view, forgery-proof health certificates that can also be used with smart cards, for example. And finally, we can have automatic testing equipment, and this is tackling the sensories, breath tester, intelligent nose, quicker PCRs, and so on. So the still open questions we have is how to avoid a new pandemic outbreak. And this is the biggest question. Strong international political cooperation is necessary. Honest and true communication is necessary. You all know what I'm talking of. And the World Health Organization needs to have a kind of a think tank. We, from this consumer technology, can only provide the means to do that. And how can we provide real-time feedback in case of infection testing, for example? So warnings to individuals, to the public. And how can we make it possible that we keep privacy on that? So the politics must provide unique guidelines, and the CT, consumer technology, is able to provide these means. Okay, these are my 2 cents on this topic, and thank you very much for listening.
Thank you, Reinhard. We will now move to Himanshu.
Thank you, Professor Mohanty. And so as Professor Mohanty also discussed, we have the things about Internet of Medical Things, and you can see that here the underlying idea that we will have a connected set of medical devices connected through some internet medium, either through some internet protocol or something like that, so that all the information can be transferred from the patients to the caregiver to the physicians, and so some of the vital characteristics can be remotely monitored also, right? So that is very essential, especially during the times. But of course, if you can think in this case, when you're looking into these things, you need to have some sort of infrastructure development come into place. And for that, the things like smart cities and smart villages can play a big role, actually, having everything smart in that way. Now, so we all actually, you can see from that, we recently edited a special issue on consumer technology based diagnostic treatment and preventive solution for COVID-19. Here you can see one editorial from all of us. So here what we put forward, especially for the COVID-19, that, for example, how can you provide some diagnosis, treatment, and prevention of COVID-19 by the possible direction could be like, for example, how can you have new sensors that can help? How can the wearable technologies can play a role? How can you use some machine learning so that the better diagnosis and the treatment can be provided? However, you can see that also nowadays, as you have seen from the previous presentation, stress, anxiety, they are also going to play a big role. And also, for example, how will you do a better quarantine management during this time? So, how can you use these consumer technologies for quarantine management, self-care? Do we need to provide people some sort of a home-based, mindful-based techniques, for example, for stress reductions? And what is the way to deliver those types of, you can say, mindfulness-based approaches to the people so that they get trained? Especially, you can say there is huge burdens on the nurses, on the doctors, and they're also getting stressed out. So how can you make them feel comfortable, and so that along with the patients, the caregivers, the frontline workers, their stress and anxiety can also be taken care of. Then, like another speaker, like for example, talk about the security and privacy issues. That is also very important during these times. How will you make sure that security and privacy issues are taken care? And along with ethical issues, for example, right now when you're doing, let's say, the vaccination trials, so we have to also make sure that the ethical issues and all those things are being taken care around this time, right? This is one example. You can see this is one paper that from our special issue that we edited. This in this paper, you can say there is a smartwatch, and that smartwatch can be used for diagnostic purposes. So you can say that person can have the symptoms of COVID-19, for example, fever, dry cough, how is their heart rate, and are they seeing some symptoms of fatigue? So you can say then based on that, this is an example for the COVID-19, but let's say there could be any pandemic in the future or in the near future, then you can develop some sort of a wearable smart face devices and accordingly have the appropriate sensors in them so that the diagnostic can be done in the real time actually, right? For example, or you can say that it may not be like the accurate as the actual clinical test, but it may at least give some sort of, you can say, indications that what is the possibilities, right, of the person having that a particular, let's say, COVID-19, or let's say a future types of disease that can arrive in the future, right? So that's a very important thing people should look into. How can you, and then another thing that you have to think in this case, if you're building a device but the device cost is, let's say, $300, then how many people are going to buy it, right? So that is one thing you may have to consider. So these IoT services can play a big role, as I told you, in so many applications like patient tracking and all those things. Consumer technologies can play roles in, you can say, in telehealth medicine, patient flow, remote monitoring. So many applications that consumer technologies can play a big role. But I like to specifically highlight one thing that I observed recently. So you might have heard that recently, especially in the India context, you might have seen that there is a big issue on the oxygen supply, right? So how can we use this IoT for the inventory and the supply chain management? That's a big issue, tracking and monitoring. And now if you see sometime with the issue with these things that people hoard the medicines, right? People hoard the essential medicine, people hoard this special like the oxygen cylinder. So how can you make sure that the tracking can be taken care? How can you avoid the counterfeiting of these oxygen cylinders, right? And then if you see another issue is that how will you make sure that oxygens are delivered to the right place through the cylinder? So one thing we think is could be possible that you can create a supply chain management through that, and through that you can use some sort of blockchains or all those methods. Then along with that, you can use some IoT paradigms. You can put some RFID tags on the cylinders so that you know that whether people are hoarding it or whether it's going to the actual users. So rather than, you can say, people logging on the log files, this information, you have an electronic tracking device through which you can actually track where they are lying right now. So that can avoid this hoarding, and this can be used for also for the essential medicines, for example, what are needed for that. So these are some of, in my opinion, that how the consumer technologies can play a big role, especially in the inventory and the supply chain management and all those things.
Thank you, Himanshu. Now we'll move to Madhavi, our next panelist.
I come from a slightly different domain of biomedical informatics. Although I'm a data scientist, I'm working in the biomedical field. So I will focus on those aspects of what needs to be, how we can help. So the various aspects that are involved in analysis or preventing or managing a pandemic are basically recognizing the disease, what are the technologies for testing, healthcare, treatment, and prevention, information, and stopping the spread and long-term management and so on. Underneath all of this is actually education, because I think we need to understand exactly how the virus spreads, what is the virus, and so on and so forth. And one of the important aspects I think that can help in future is if the world is educated about exactly what the virus is and how it spreads, and what we need to do in order to prevent it. And the work that I'm presenting also focuses on the fact that there is a culmination of various different technologies. Biotechnology is involved, nanotechnology is involved, and consumer technology is involved in bringing certain aspects together that can contribute to all those factors that I have shown in the previous one. And in the spirit of education, since we are in a panel and audience of electronics people, I thought I'll spend 1 or 2 slides on explaining exactly what happens in the virus. A virus particle is a very small particle that contains a DNA or RNA of the virus. It doesn't live on its own. It can't spread. It can't duplicate, replicate on its own. Unlike all the other living beings which can reproduce, virus can't. And the way it propagates is that it actually interacts. This is a virus particle, and this one is a human cell. It comes and binds to a protein that is on the human cell, and it injects its DNA into the human cells. And then by injecting itself, it makes our cells make copies of itself. So it doesn't do anything. It doesn't do the copying by itself. It actually depends on our human cells to make copies of itself. And then those copies are assembled into new viral particles, and then they all burst open from the human cell. That's why the human cell would die, and therefore create multiple copies of the virus. And that's how a single nanoparticle of a virus can bring down an entire human being, which has trillions of, the size of human in terms of cells is like trillions of magnitude over the virus. And this particular coronavirus actually can affect various different organs. As we all know by now, I suppose, it has effect on not only lungs, but brain, intestine, heart, and various different organs and tissues. And the mechanisms by which it works is actually that everything that happens in our bodies are happening because there are very tiny molecules called proteins, and the proteins are carrying out various different functions. For example, there's a protein to allow calcium ions to flow through, another protein to allow sodium ions to flow through our cells, and so on and so forth. So what is happening is all these little molecules are carrying out all the functions in our bodies, and the virus is basically attacking those proteins. And what the technology has enabled, so I mentioned that part of the research in this whole prevention, recognition, this RT-PCR test that we talk about, and so on, all of these things are based on the fact that virus is attacking a specific, no, actually, I'm sorry, I got deviated. What I meant is, in all of these testing, the things that have come together are biotechnology and consumer technology and nanotechnology coming together. And this particular study is a very good example of how they have contributed. They have assembled scientists all over the world, and everybody has contributed a little bit in identifying which of the human proteins the viral protein is targeting. And they identified that this is the viral protein that's targeting these human proteins, and what their social interactions are. So just the way we do social network analysis, when we look at Facebook, we look at who the friends are, and based on who the friends are, we are able to determine what an individual is doing. And a similar type of data analysis can help in understanding what the virus is doing. And how do we put all of these things together? So recognition of arrival of pandemic. So we have thermal sensors, activity sensors, sleep sensors, like other speakers have pointed out. We have public health data. That is, if you can, we do have, especially in the US and other developed nations, we have data of how many thermometers are being purchased and how many paracetamol, Tylenol, temperature reducing medicines are being purchased and so on. And this data is electronically collected and it's public health data. And by making this data available, epidemiologists are able to model the data and carry out analysis to find out that hey, there is an incidence of flu, or there is an incidence of something more severe than flu, and so on and so forth. And now with the consumer electronics era, we not only have that type of information, but we have things like step counters, activity modeling, and so on. So we move from what is called equation-based modeling to what is called agent-based modeling, each agent providing the type of data that is connected with consumer technologies. And testing for infection, I mean, I don't want to necessarily go into every one of them because we only have a few minutes, but the point is that each one of these measurements is contributing to the ability to test whether a person has symptoms that are related to the emerging disease. And in fact, tomorrow, actually, there is a thesis proposal or thesis defense by a student who's recognizing ailments based on human voice. Our voice, we may think, so it's not only that we can recognize what is being spoken, but the voice contains more characteristics about whether a person has inherent disease, and it could be a small disease and it's temporally limited disease, or it can be a chronic disease. And a voice is able to capture that type of information. There is really very good work that's going on at Carnegie Mellon by Rita Singh on this work. Retinal scans with smartphones, and you get the trend. The other type of work that technology can make happen, just like, okay, so we talk about telemedicine, right? Telemedicine is to fix people's health problems. What about fixing health problems of devices, right? So there's a very nice work that's being done by one of my colleagues on oxygen concentrators. And a lot of the equipment is just thrown away just when it becomes, when it doesn't work, it's just thrown away rather than being repaired. And there are many such devices. And now in low-income countries where they don't have the equipment, they're actually repairing these and they're sending it out. And you should look at this particular page about OpenO2 to find out how to fix devices for reusing and repurposing. And there is a lot of work that can be done on repurposed drugs. And this involves basically data analysis, biotechnology, and whatnot. And of course, once again, it requires education in terms of what is the biology that is required. So I feel that there's so much the consumer electronics world can contribute to the advancement of science. And in order for them to be able to contribute, first, the education has to bring to them the knowledge of what is the biology behind the viral spread and behind the pandemics. If somebody would just let me know when the time is getting done.
Maybe just finish this one. It's okay, just finish this one.
You have 20 more minutes.
Sorry, what? 2 more minutes?
No,
20.
No, that's the overall panel. We'll go to the page 2 of the panel. So can you finish in 1 minute, by the way?
So, so this is one type of data, a technology advancement that produces what quantity of different proteins are there in a given tissue. So you take the heart tissue, you take the lung tissue, and so on and so forth, and you can find out exactly what quantity of a protein is expressed. It's very commonly used in the biomedical informatics world. And what this data, nobody did this for COVID in such a urgent manner. I mean, they did, but what I mean is that there's been some other work that has been done that contributed to repurposing of drugs. So what they did is they studied every drug that there is out there and tested how does it affect the quantity of expression of different proteins. And when there is a disease, the same thing happens. Different proteins are aberrantly over or underexpressed. Now, what you want to do is to find a drug that has the opposite effect on the gene. So if there is a gene that is overexpressed, you want the drug to underexpress it, or if it's underexpressed, you want the drug to overexpress it. Simply by putting these two pieces of information together that have already been there, people are able to do the drug repurposing. And so these various aspects that are being done, they all have engineering, they have electronics behind it, they have biotechnology behind it, and so on. The other aspect is, like Kousik mentioned, there's an aspect of information, which is there are many people who believe that it's a hoax. There are many people who believe that vaccines don't work, and so on. And there is also a lot, not only about misinformation, but also about spreading the correct information. We may have a lot of information that is there in some languages like English or Spanish and so on. And how do we make sure that this information is available to the local people, like villagers and people who don't speak this majority spoken languages? How can we convey this information to them so that it's available at their fingertips and they know how to distinguish between information and misinformation? So that's a type of, oh, this is a very nice example I want to just mention. So this was developed many years ago on a telephone system in Pakistan. They wanted to make sure that unemployment can be tackled by just letting people know that there is a particular employment opportunity. So what they did is they created a little app that you can use on basic telephone. So you speak a message, and let's say I want to send a message to one of you. I speak it, and then I make a transformation on it so that it speaks in a slightly different language, like as if it's spoken by a monkey or a person who's drunk, or anyway, various different transformations. Those are the options that they have given. But the point is that it sort of makes it funny, and then they send it. And this thing has become, it's one of the first examples of viral information spread. And although it was done in a funny way, it actually made sure that the information about jobs reached unemployed people, and it contributed quite a lot. And the same technology was applied for spreading information during Ebola epidemic. And read about it from Professor Ronnie Rosenfeld's work and so on.
Okay, thank you. Yeah, thank you, Madhavi. So with this, we'll move to next phase of this panel, where we'll have some questions, and then panelists will try to answer those. Okay, so we have a lot of questions, but I will, in the interest of time, probably 4 or 5 will address. Let's see the first question. Can smart healthcare stop the spreading of pandemic outbreak? What is your panelist opinion on this question? Himanshu, you want to go first? Can smart healthcare stop the spread of pandemic outbreak?
Yes, so I think that's a good question. See, of course, say example, the smart healthcare can, I won't say it can completely stop, but it can definitely minimize, actually, the impacts of those things. So some examples that we discuss is that, like, early diagnosis of the people. So one of the things that you see, that many people who are severely, or you can say, are getting or dying because they don't know that they are already infected with the virus. So it is almost 4 or 5 days by the time the lungs are severely damaged, right? So if we can, let's say, diagnose the people early with consumer technology, let's say within 1 or 2 days when they're getting exposed, so the survival chances significantly increases. So then even the medicine will start working, and that's how I think that we can mitigate the impact.
And anybody else wants to answer that? Reinhard?
You're muted.
Reinhard, you want to enable?
Yeah, okay, thank you, sorry. Yeah, definitely, I think the consumer technology can help, but we can start very early. For example, many of the outbreaks have been started while people came in or went out to another country and transported this virus. And they could bring it into the country because there was no sufficient testing. So if we have consumer technology that is able to recognize very early how we are feeling. And I spoke about the intelligent nose, for example. If we have some kind of a smelling device at the airport, and just when people are passing by, they are just blowing their breath into it, and it is diagnosed, that would be something that would be really, really stopping a serious outbreak. And I can give many more examples like this for local spreading in the same way. It's always a matter of time, and if we can save time, we can stop the outbreak.
Okay, thank you. So anybody else wants to answer, discuss, then otherwise we can go to next question. Okay, Kousik.
So, so I completely agree that smart health, smart health tech would be able to sort of avoid or at least curb it to a large extent. But again, as was mentioning earlier, this is just one axis. You need to combine it with other actually non-technical axes to be able to provide an effective solution. So that's the
Okay. Okay. Okay, so let's go to another question. What is the role of healthcare industry during the pandemic outbreak? What are the roles of healthcare industry? Madhavi, you want to answer? Okay, Reinhard, followed by Madhavi.
Maybe just a starter. Sorry. I mean, yeah, the healthcare industry has an important role in that way, that they should provide communication means. I mean, we have healthcare cards, for example, for many insurance companies and people and so on, and these must be provided to everybody. And they must be enhanced in that way that we can put information on them and make them securely and safely usable. And this is a big issue for the healthcare industry, I would say, first of all.
Okay.
Yeah, I want to add that, one of the things that became very clear during this pandemic is that there is a lot of communities who are disadvantaged in getting healthcare. And it could be because they don't have the insurance, they don't have means, or whatever mechanism it is. And this is a time for the healthcare personnel from all levels, whether it's administration, doctors, nurses, and everyone, to figure out figure out ways by which they can ensure that healthcare reaches every individual who needs it. And whether it's geographic distancing or the finances behind it, or whatever it is, even including language barriers, everything. So they have to come up with innovative ways so that they make sure that healthcare reaches everybody.
Okay, Kousik, you have any comments?
No comments.
I think I have one thing to say actually, because if you see, one of the things that should be addressed is to provide the technologies or the healthcare facilities to the people at the low cost. For example, let's say if you see, if somebody get admitted to the hospitals and people doesn't have an insurance, then it is going to cost them thousands of dollars. Or let's say if it is in a low earning places, right, then it is very significant. So many people doesn't want to go to the hospitals for the treatment because it's very expensive, right? And hospitals are also getting overcrowded. So can we build some sort of a smart cot, or we can say smart beds type of things, which are very, very low cost? However, another thing that you see, so if you see, many people even don't know how to use oximeters, right? So can we create such, like, for example, where people are not aware, not that much, you can say, technology advanced, a simple feature, so we can have a plug and play type of cheaper types of beds, so that can be used and trained to the, let's say, people in the rural areas, so they can just get connected to the oxygen cylinders or to the necessary medicines without too much training of the advanced facilities. So can the consumer technologies can come together here to create this advanced feature, but at a very, very low cost.
Okay, very good. Thank you. I'll have another question now. How smart healthcare be different from smart villages as compared to smart cities? Smart healthcare in smart villages versus smart cities. That is the question of discussion now.
Actually, you are the expert. I'd like to hear what you have to say, Dr. Mohanty.
Sure, sure. Okay, so maybe let Himanshu go ahead, then I'll follow up.
Right. So actually, like for example, one thing that I think right now in cities, you can assume people are educated, they are, or say they are technology savvy. Same thing, you cannot expect that much in the village setting. So you need to, so the things are very different. For example, it might be possible that people may be much more willing to take vaccination in the village. I did not do the survey, but this could be interesting study to do. How many people in the cities, what is the ratio of the vaccination ratio in the cities to the village, right? That could be a very good study. And based on that, you can see that what are the factors, what is the difference underlying there. So one thing that I can say is the lack of awareness. Similarly, let's say there may be not enough good doctors in the rural areas. So telemedicine can play a big role, right? For example, telemedicine may not be, and that is, we have seen that is very useful during this pandemic time. But similarly, in the rural areas, this telemedicine can play a big role. So you can train people, like say the chief of the village or some people, and then those people can create like a small booth and all those things where many of these medical facilities could be provided. So that's what I think is that. So in other words, the paradigm will be very different in the rural settings compared to advanced settings where people have to access to the high quality healthcare facilities.
Okay, so if I want to add on, okay, maybe Kousik, okay.
Sorry, Mohanty, you go ahead.
Sure. Okay, what I wanted to say, actually, smart village paradigm, okay, is way different from smart cities paradigm, in the sense, like in the village context, we have to really assume there may not be power supply, there may not be internet, and people may not be willing to pay, okay, even if they have health issues, because they may not have the cash flow. So it's really complete different challenge. We are talking about here telemedicine, smart healthcare, and also on, but people may not have internet. Okay, so then how do they get health? Health issue is still there, right? People may not have power. Let's say you have what I say, let's say a ventilator, but if you don't have a power supply, how the ventilator will run? So those are actually very fundamental challenges. So how do we do vaccination when people cannot go to a website to register themselves and then get a QR code to go to the vaccine center to get vaccinated? So what is the method? Is it walk-in or something else? So we have to develop complete different smart healthcare paradigm under the assumption that there may not be good internet connectivity, Wi-Fi, 4G, 5G may not exist. How we still provide? And telemedicine we're talking about, but if there is no phone communication, how do we do with a very low bandwidth, maybe just a minimal text messaging approach, okay? And the power supply if not there, and temporarily some power delivery approach is there, let's say coming from a generator, kind of very minimal power supply, then how we manage in that context. So those are actually important challenges. So smart healthcare or telemedicine may not even work in village context the way I imagine. For example, let's say you have already pandemic going on, and then there is a cyclone, kind of super cyclone, those kind of things coming, which is most likely in the eastern region of whether it's India or US, those kind of eastern side typically get cyclones. So how do you handle those situations? So low cost, how do we assume with very minimal internet connectivity, and even there may not be power supply. In that respect, healthcare has to evolve quite a bit in the smart healthcare framework to operate without constraint, without resources. That will be my point of view. Thank you. And Kousik, you wanted to add anything to it?
Yeah. So so when we talk about villages versus cities, right? There's the other actually geographical aspect of that, and what about tech? I mean, the thing is, in terms of, I mean, of course, I'm just looking at now only tech, just from a pure tech standpoint. If we take the lowest common denominator of tech that works in certain a village community in a certain geography, there is a very high chance that that same tech with a few more additions would work in the city. But then that said, this is not true in in all the scenarios, but I think by far in a lot of the scenarios, I find this to be true. And also as an industry practitioner, what I also see is that the mindset. So just for information, just a few months back, I had to go to a small village in South Tamil Nadu, which is called Irungur. And I was very shocked when I went there. I was just interacting with some social service organization. They said, there's no coronavirus here. We don't need to wear masks. Yes, there is a virus outside this village, but you see, we are actually eating fresh food. We get fresh air. Our immune system is very, very good. We don't need masks. We don't need social distancing. And then there has not been a COVID case there till date. And this was as late as 2 months back. And I didn't have an answer to that because at least during the initial days, you could say, hey, that's still okay, be careful. But then, already actually a year of coronavirus has passed and people come in, go out. So that's another aspect to consider.
Okay.
It just sort of highlights that,
okay.
We know very little.
Okay, so thank you all. I think with this, we'll go to the next phase where we'll open the floor to the audience. If audience have any questions for the panelists, please go ahead.
Hi, it's good seeing you. So let me say hello from my end as well. Saraju, Kousik,
Sure.
are you well? I hope you're all fine and coping in these heavy times. Thank you very much for touching on this very sensitive topic. And we saw a plethora of technologies, and also Professor Madhavi told us a little bit in depth about the virus itself and about the possibilities to use technology to detect things there. And I think we heard a lot of interesting stuff, but I have one inherent concern and one question is about the possibility of us humans, like the 5, 6, 7, 10 of us here in the conference to 20 of us. What is the potential of us coming together in the form of an organization to the likes of World Health Organization that I don't believe that is that successful, so to say, in unifying the platform that would allow, let's say, whatever we have of the bits and pieces to be there. And I think the World Health Organization cannot do that on their own. And the question for you, Saraju, and other panelists as well, do you feel that we might be able to construct a movement technologically speaking inside IEEE, or are there any activities ongoing in that regard that I may be not aware that tackle specifically the digitization healthcare systems with response to the emergency situations?
Okay, anybody wants to go first on this question? Himanshu, Kousik,
Yeah, I'd like to just make a comment. I'm not familiar with whether there's any effort going on to form an organization. But the one thing that I have been saying very recently is that, biology and electronics, it's time biology and electronics have gotten together. So far, we have seen biology and data science getting together and doing great work. And I think it's time that the electronics also joined the team to do newer things, because we now need molecular sensors in order to detect these type of things.
Okay, Reinhard, please go ahead.
Yeah, just also a small comment. I mean, I'm still insisting on we have the politics that is in this place, and we need to talk with them. But first of all, now we have heard a lot of things from the virologists and those people that are familiar with epidemics and pandemics and so on. But now the technologists should raise their voices, but they should do it very, say, substantial. We've got a lot of small solutions, simple solutions, but easy solutions, but not only, but maybe sometimes not well thought solutions. So now we need to make a task force and developing new sensors, new technologies, and propose them to the public and raise our voices to the public. And this is something that the IEEE can do, of course, definitely. We have the societies for that. And CT is one of the societies for that.
Okay, anybody else? Kousik?
Yeah, I'd just like to add a small point. So with respect to IEEE, we have not seen any. I mean, of course, there are a lot of standards, all of that, but in the healthcare world, right? In the healthcare, which is spread across geographies, you have a lot of data. But then making the data talk to each other, right? The interface standards, that's something which is not there. But whereas if I go to the medical standards, there is FHIR, there is HL7, etc. But that's not really being enforced. So it's not only just the technology, but also actually the regulation and then the politics and all of that, which has to come together and then form and then sort of develop this further. That's my 2 cents.
Himanshu, you want to go ahead?
Thanks. So yeah, it's definitely a good. I'm thinking while listening at the same time, because it's not easy to grasp on what would be the first step. Like who is from which angle it goes first. So this is the most important question. And whether we force, let's say, the healthcare providers to provide interfaces to plug in to some kind of a network, a global network, and to mandate that in some way. But then of course it depends on the level of agreements between countries themselves, what ends up being a political thing. But I think technologically we should have a framework that can be applied if allowed and if approved. And I don't think that is actually in place at this point.
Right. And Milan, I wanted to add a little bit. That is, IEEE is really an excellent organization to do. It's in the right, what you can say, framework, because it's present globally, and it is not political, not profit. So that is a lot of respect is there. And if you see, this week, a few days ago, I gave a webinar on same thing, IEEE Smart Cities Community on the Smart Healthcare. I gave a webinar. So I see smart cities, smart village, the way to measure initiative from IEEE, which has done a lot of impactful work around the planet. Okay, so similarly, smart healthcare can be part of it. Okay, or it can be another initiative. Okay, and it's needed. Okay, definitely. And I see IEEE can do it. For example, you see JPEG standardization was done by IEEE. Okay, and as far as I know, USB 2 and so on, IEEE has been reasonably involved. Then similarly, Wi-Fi standards and so on. So IEEE definitely can do, which will be globally accepted. So smart healthcare initiative has to happen, and maybe city society does, and maybe there are other societies, computer society, and so on can do. Okay.
Okay.
Thank you.
Okay, so I think one last thing, and I think we are running out of time. Please,
just a very short remark on smart healthcare. Smart healthcare is a very sensitive thing in terms of human using it, and that means we need to think very carefully. We are all engineers, and we are all thinking like engineers. That means we see a problem and we find a solution, but the solution is maybe not the one that is sufficient to fulfill all the requirements, just talking about security and privacy and all these things. And we have to think very carefully if we implement cloud technologies, for example, and something like this in healthcare industries. Okay, just this.
Okay.
Thank you.
Okay, let me suggest something. Let's not close this discussion. Let's keep it open, even in this circle that is currently on. I don't mean today, but in the very close future, and maybe to renew these kind of meetings in some of the subsequent events, or maybe even before, and to touch base on what specifically can be done, maybe instead of giving a broad overview. I thank you very much for the participation wherever you are currently around the world. And I just didn't ask the floor whether there are some questions from the floor. No? Okay, then this closes our panel on healthcare challenges versus in the pandemic context. And I would like to invite you for our next very interesting panel after a short break. Even this team here, we will have guys that want to repair stuff instead of letting them break and harm our environment. So this is also another very important topic that we have the place here at ZINC conference. So this is our last panel that is going to be really interesting. And after that, we'll have the closing and the best paper ceremony, best paper award ceremony. So stay tuned for this very last bit of the program. And I wish all the panelists all the best in their future work, future weeks, and let's stay in touch. Okay.
Thank you all for the
Together. It was
Thank you.
very interesting.
Thank you all.
Take care. Bye.